Hi everyone, my name is Michelle and I'll be your instructor today. Today we're going to talk about the best practice for ultrasonic scaling. How can we enhance efficacy and safety in patient comfort while we are working as a dental hygienist? So the objectives for this class is understand what is the ultrasonic instrumentation device, what is the mechanism of action of ultrasonic scaling, and the difference between ultrasonic instrumentation and manual instrumentation. We're also going to talk about the advantages of power instrumentation, and we're going to talk about the limitations of the power instrumentations and cleaning efficiency techniques using ultrasonic instrumentation, how this can help not only us as clinicians, but also our patients to have a better experience. So, when were developed the power instrumentation devices? So in the 50s was the first time a first electronic powder instruments was invented. So, but during this time they were very bulky. So in the 60s and 70s, heavy calculus deposits was removed with power tools. So it was a very bulky design. The work and was restricted only for supragingival instrumentation in only areas that the instrument could have access to be very bulky and big. So subgingival in like tight areas were not recommended, but were good for big areas, probably like you will see like when people have lingual calculus on the lower interiors. I think I would think in that way. In the 80s, in the late 80s, where the slim working ends start to come out. So with the slim working ends, they were way smaller than a working end of a typical Gracie curette. So we have this power instrument who does a very good job getting calculus out of the teeth, and now they're able to do it more subgingival. So is where everything started, that starting look like what we are used to nowadays. So, and with the instrument, the powered devices has been demonstrated that they working ends are just as successful as manual tools in eliminate bacterial products, biofilm, and subgingival calculus deposit in the teeth with periodontal disease. So there is a studies showing that both instruments can be if they can have efficacy in removing calc, bacteria, and any other products from periodontal diseased pockets. So how does the ultrasonic scale work? So basically the power instrumentation devices, they use rapidly vibrating irrigating working ends that dislodge calculus from the tooth surfaces, disrupting plaque biofilm and flush bacteria from the periodontal pockets. Usually consistent in an ultrasound generator, which is the bottom, and a handpiece, and an interchangeable tips or insert. So we have the handpiece and we put inside. When we see the tip of the ultrasonic scaling, we see filaments. These filaments, they vibrating. They vibrating, and it's a frequency of sound waves, but we can hear them. So they vibrating together, and that makes the tip vibrating. So that's why it's important to have water when we need to, the handpiece, we need to fill it up with water all the way up and insert in the vertical way. So when this very thin filaments vibrating together, if there's any bubbles, like air bubbles, it's gonna get hot and it's gonna get our instrument hot, and this can cause thermal injuries to the patient. So it's very, very important to make sure we flush our device and we fill it up with water all the way before we insert the tip. Okay, now we're gonna compare the difference between the hand and powered instruments. When we talk about mechanisms of action, we can think about what the ultrasonic instrumentation does. And has different mechanisms of action. We can think about mechanical, like removing the calculus, and cavitation, like all these bubbles that when we are ultrasonically causes. So, and then water irrigation. So that's the main mechanisms of action of the ultrasonic scaling. And also, when we think about the hand instrument, it has one mechanism of action, that is the calculus removal. So we mechanically go there in the pocket and remove the calculus. Does not irrigate it or anything, or they have any cavitation powered. It's just like we mechanically removing calculus with our strength, our technique, in our instrument. The size, when we think about size of instruments, ultrasound tubes have small working ends. If you see a mini slime line tip, it's very thin. It's almost like a needle, like a thicker needle. And we know that the working ends for instruments are it's a little thicker than a very thin ultrasound tip. We do have instruments that are thinner, and we have ultrasonic tips that are thicker. But if we think about in regular life, a prophy patient or a recare patient, we want a thin instrument because they don't have like big pockets, or most of the time they don't have a lot of buildup, so we can use like a thinner instrument. When we talk, and also the position, when we are using ultrasonic scaling in a patient, we can go coronal and then go all the way to the gum line and to the under the gums. But when we go with the hand instrument, we need to go beneath the calculus to remove it. So it's we go under the we have to go under the beneath the calculus into the coronal direction, while the ultrasound is going to give us a little more flexibility going coronal to the gingival. Doesn't matter, it's not going to affect. It's even better to start at coronal and then go to the gingival margin. Another really important point about the difference between them is tissue trauma. We can traumatize the tissue with the ultrasonic scaling. A tip like the mini slimline tip is very thin, and you can definitely poke the gum. You can definitely hurt the patient. If the instrument is hot, it can cause thermal injuries. But if you use very gentle, sideways, never the tip, we can have a less trauma in the patient gums, and if trauma happens, it's faster healing. When we think about hand instrumentation trauma, it's more likely because sometimes the instrument is very sharp, it's way bigger. Sometimes the person has a very small teeth and you have like the instrument that is way bigger, and you can definitely sleep, or it's more likely to cause trauma than, and the trauma is bigger, so it takes a little more time to heal. Another point is sharpening. As a hygienist, we need to keep our instruments sharp so we can use them and not cause any burnish of the calculus or any overworking of your hands. So it's very important to have our instrument sharpening. So that's the difference between them. Like if we have ultrasonic scaling, you don't ever need to sharpen. You never ever need to get a stone and sharpen your instrument. But if you have hand instruments, you need to sharpen them. Some Cs say like every 20 strokes, but I think it's more like when you test it out and see if it needs sharpening or not. But it does take time, and if you have a full schedule, like you barely have time for lunch because you have notes, you have to see your patient, your doctor is always running behind, and you're just managing 20 things at the same time, and you almost never have a break. When you're gonna sharpen your instruments? So it's very hard to find time to sharpening. And when you do, you can just sharpen as many. You cannot sharpen the whole, everything that needs to be sharp. You cannot, all the cassettes, you sharp some, and then next time you sharp. But it is time consuming, and sometimes it doesn't happen so often. If you're lucky, you can have an office that sends somewhere for sharpening. But mostly that I have been experienced, the office won't send anywhere. It's more up to the hygienist to keep them sharp. So that's another benefit. If you use your ultrasonic, you'll never have to sharp the tip, and you can also have your instruments lasting a little longer. Because also every time you sharp, you take instrument out, and eventually you have to replace this instrument, which is normal. There's nothing wrong with that. It's just using the ultrasonic helps you to keep this instrument for a little longer. The last point you're going to compare them is the pocket distension. So instrumentation with ultrasonic has minimal stretching of the pocket wall, because the thicker tip you're going to use supragingival, and the thinner tips you're going to use subgingival. And the box is very big. You can use a triple band or something that is a little thicker, but you have space for it. In the hand instrumentation, since you have to positioning the calculus beneath the deposit, that can cause distension of the pocket. So you need to go beneath the pocket, so you need to stretch the pocket a little bit. Then, like I said, they can take a little time to heal sometimes. If you can use your ultrasonic scaler, you most likely will have like less minimal stretching of the pocket wall. And now we're gonna talk about the benefits of the ultrasonic instrumentation. We have been talking about all the benefits. The first one is pocket penetration. Like I said, the slim diameter, the tips can reach deeper, the periodontal pockets. So we can go a little deeper without stretching the pocket, without causing any damage, or going, if we don't need it to, like we don't need to go beneath the calc to get it. We go in the calc, and then we can go coronal to the root, and we can stop when we don't need to go anymore, instead of go all the way under to go in the coronal direction. Another very great benefit that I personally think is one of the most beneficial of the ultrasonic instrumentation is the fluid lavage, the water irrigation. So when you're water irrigation, you're taking all this calc, all this plaque, all these things, and you can still see what's going on. Sometimes if you're like hand instrumenting a patient, you're getting all this calc, all this plaque, and you're like, I can't see anything anymore. Then you need to give a patient rinse, and then you need to keep doing this until there's less material to get it off, and then you can see better. But with the instrumentation, with the ultrasonic instrumentation, you can see a little better because you're removing blood, and also you remove toxins, free floating bacteria, and plaque, biofilm, the bad stuff in the gums. You're doing all at the same time. Patients having like 100% benefit there. And another great one is the cavitation that is linked to the fluid lavage. while cavitation is the creation of bubbles. When we see the vibration, the water coming out and the bubbles that comes, we think about these vibrating bubbles. They are waves of shock, so they are disrupting the matrix of the biofilm. The biofilm is like a spider web all graining together. So when you go with the vibration, the cavitation is like breaks this down, and so the gums can heal, the gums can be healthier because there's no like all this bacteria living there. Another great thing we can do is assess trifurcation. We can treat fructation class 2 and class 3, but it is technique sensitive, so you need to go slow there. Make sure you know what you're doing, going sideways. If you need, use your Explorer just to make sure you know where to go. And but yeah, it's pretty great using for fructations class 2 and class 3. And another big benefit is the instrumentation time. So we have to take sometimes FMX, full mouth x-rays on the patient, and then we have to probe, and then you have to update health history, and we have to talk about them. How you're doing? How is everything with you? We need to understand, like, are they going through a huge amount of stress right now, so their gums are inflamed because they're going through a lot and their body can process everything, so they're getting sick from it. So we need to understand, like, we need to connect somehow with the patient. So we have all these tasks to do in 1 hour, plus switch a room, clean everything, make everything ready for the next patient before this hour. And we need to wait for a doctor who is probably very behind, and it's so much. Plus, like, in the office of work, we have to schedule the patient for the next visit. Then we have to do notes. It's just so much. So the ultrasonic scaling, they help with the instrumentation time. So when you can get there with the ultrasonic, be very patient. Go on and back. Go every tooth with like very calmly, and every tooth, just don't like wash it off like painting. We're not painting anything. You're just going slow, every tooth, every surfaces. Like, make sure we are getting everything out, and then we can go back with our instruments and double check everything. That saves a lot of time. We are doing a bunch, like, it just saves a lot of time. Patient can have every single teeth very cleaned, leave without anything in their mouth. If we can, like, ultrasonic everything and then go double check and touch up in a few areas that will need it. So the instrumentation time is good for them because most of them don't like to be there, and good for us because then we can deliver the best we can. So our goal is always deliver the best we can for the patient. Always work the maximum we have. Like, oh, this is the maximum that we can give to the patient, so we're gonna do it. So that helps us to achieve that. Okay, not everything is for everybody, of course. The same is the ultrasonic scaling is not for everybody. We're gonna talk about some of the people who should not have ultrasonic scaling being used in them, and they included people with communicable diseases, like some with tuberculosis or anything that can spread in the air should not have be treated with ultrasonic scaling. If patient has respiratory risks, so if they have like a chronic asthma or any chronic obstructive pulmonary diseases, so because they can inhale this they can aspirating this to their lungs, they can develop aspiration pneumonia. It's very, very hard. So patients who cannot breathe or have this respiratory risk, they should not, it's not worth it, the risk for them to use that, even with like relief or dry shoot or anything. The same with chronic disease. Even if you're wearing using a dry shoot or any HVE device, you should not use the ultrasonic scale on them. Dysphagia, patients with difficult swallowing. Like we see this with Parkinson's patients. They cannot swallow very well. So any patient who has like hard time with their muscles, they cannot swallow very well. So we're not using this because they can aspirate the bacteria, water, and all the biofilm, all the things that shouldn't be in their lungs, to their lungs, and have aspiration pneumonia. So it's very, very important to not risk using with them, because once they get pneumonia, aspiration pneumonia, they have all this bacteria in their lungs, and they can cause very, very serious problems with them. They might not even come out from the problem. So we need to be very, very aware, because someone has one problem like Parkinson's or anything, they should add one more to their health. Patients who are susceptible to infection. So we are talking about people who are going to chemotherapy or any immunosuppression disease. So we need to be very careful with these patients, get always clearance if we can like even touch them and use anything. Like we have to be like so careful with them. And the last one, cardiac pacemaker. While right now, as we know, a lot of pacemakers, they come with a shield, so it's protected, it's fine, there's no problem. But there's no much research between, you can or you cannot. So always make sure you contact their doctor and just double check, get a clearance. Okay, this person is good to use it, and that's it. So, and if you're not sure, just contact their physician, like in this case, a cardiologist, or whenever the doctor it is, like if the cancer patient, like anyone, just make sure you get a clearance so you can do your job and make sure you're not causing more good than harm. And we are talking about a lot of the effectiveness of ultrasonic instrumentation, and we know if the used by a qualified medical professional, part instrumentation can remove subgingival plaque and biofilm, supragingival calculus, subgingival calculus as well, and the same as the hand instrumentations. And if we can use them, we can get in the pockets, we can wash it off the bacteria, the biofilm, and we can do it in a short time. So patient, it'll be more comfortable for the patient, more comfortable for you. For this activity, we're gonna have 30 minutes, and we're gonna have our typonut set up, and we're gonna divide 10 minutes for one. We're gonna be 2 students together. We're gonna partner up, and we're gonna have 2 students working together, while one is using the Cavitron with the patient. With the typodont, we're gonna use the other one is gonna be notes. So if you see the clinician, if you're not the clinician, you're observer, you see them touching the teeth with the tip, or if doing anything like not filling up with water before I insert the tip, or anything that it's different than what it was taught of today, we're gonna make notes, like just bullet points of this, and then we're gonna switch, do bullet points, and then in the end we're gonna get the bullet points, and we're gonna write the right way to do it, and then we're gonna redo with the right way. So we're gonna get two papers with the bullet points of each, one being the observer one time and the other be the clinician, and vice versa. Then we're going to do this together. Okay, yeah. Okay, here we're gonna see a demonstration of the ultrasonic scaling.
And honestly, it depends how tenacious their calculus is, how much calculus they have, how much inflammation, how deep their pockets are, etc., etc. We can't say, oh, I'm going to ultrasonic for 10 minutes every patient. Every patient is so different. So one thing you want to do is make sure you're actually, when you're using it, you're utilizing your time the best you can. I've seen a lot of people just do sweeping strokes. They go kind of fast and they call it good. But if you have a deep deposit, big deposit, don't be shy to spend some time on it. As long as your tip is in constant motion, you can be in there for a while. So I'm going to activate on this deposit. I'm going to go down towards the base of the pocket in a curette style. But see how I was in there for a couple seconds? Nothing really came off. I might have to spend a little bit of extra time in these tenacious deposits to make sure they're being removed. Down to the base of the pocket, down to the base of the pocket.
Yeah, like we saw here, she was using the ultrasonic on the side of the ultrasonic and with the water coming out, and just utilize her time as best as possible. So is what we need to do. We need to have a good angulation and make sure we are using the ultrasonic with patient and gentle all the surfaces of the teeth. So when we can come back, use our Explorer instrument and just double check if we get everything, and get our other instruments, a curette or whatever we gonna use, and maybe sometimes just smooth it out that area and take it out any remaining calculus. But yeah, always holding the instruments in the colorful part to make sure we set up properly. And there's different kinds of Cavatrons machine right now, so just make sure you know how you are supposed to work. Yeah, and thank you so much for your time. I hope you all learn a little bit about the ultrasonic scaling and maybe consider incorporate in your day as a hygienist. Thank you.